Hello, I'm Barbara Houlding from Canine HS Courses, and I'm delighted to share my top 10 tips and 30 on canine movement enrichment techniques. And lovely Lily here is going to help me. I was the first UK accredited clinical educator awarded by the Chartered Society of Physiotherapy in the UK in veterinary physio, and my passion is all about dogs. And I want to share some very exciting treatment techniques with you and the concepts behind them. As a canine therapist or a canine professional working with movement dysfunction and wanting to impact on that positively, the first place to start really, and a great place to start, is think about the type of movement that you want to influence. So movement is divided into 4 key groups. Group 1 are your reflexes. They're your most simple form of movement. They're involuntary responses to a sensory input and they have no threshold. And so these are going to be your pupil dilation, they're going to be your patellar reflex reaction, which is a monosynaptic reflex. These are your defense against harm. This is a reaction that the body does and it's a simple movement. Your group 2 is slightly more complex than group 1, and these are your fixed action patterns, which are involuntary responses with a stimulus threshold. So it's like you're coughing and you're sneezing. Now, as a canine therapist, I am not looking at these 2 groups particularly. What I'm very focused on is identifying the species I'm working with. So as a human physio, my attention is in group 4. These are directed movement patterns. They're voluntary and complex, and humans use these predominantly. However, as a canine physiotherapist and specialist in hydrotherapy, it's group 3 that gets my attention. This group is all about natural balanced motion in the dog. They are rhythmic motor patterns, they're repetitive, complex patterns, but they're subject to continuous voluntary control. The dog is innately designed and uses CPGs, which it has in abundance. These are your central processing generators. They've got so many in their thoracic and lumbar spine, and these give this rhythmic motor output, and we're going to talk about those in the next point. Whereas group 4, these are the movements where some people feel that to teach a dog to sit up and beg may be useful. It's not that useful to engage the core because it's a directed movement. It's not what dogs do very much of. But if we can find the way to work with the core using rhythmic motor patterns, like your canine enrichment techniques, your alignment techniques, and your movement shaping techniques, they're going to map into exactly what the dog needs to improve their movement significantly. Once you've established the type of movement that you want to improve or address, we've also got to think about the biomechanical design of the dog. So the quadruped is amazing. It's got 4 legs that support it against gravity, and they are designed to accelerate the dog forwards in the sagittal plane. We have 2/3 of the weight going through the forequarters and 1/3 of the weight going through the hindquarters. So that's 30% the left fore, 30% the right fore, 20% the left hind, and 20% the right hind, if the dog is in a natural balanced stance. So the moment the dog moves or moves its head, it can vary that by 10 to 15%, and it depends if it's walking where the loading is. Now, on top of that, the normal for the dog, for each breed that you're looking at, we've also got to consider if they've got any underlying condition, because that's going to alter the loading of that distribution. So my favourite analogy that I use is being the car analogy. I've used that for over 20 years. So if you think of the dog's skeleton as the chassis of your own car, and your car is probably a different shape and size to somebody else's car. So breeds come in all shapes and sizes. So the skeleton is brilliant at giving the chassis a shape. It gives it protection. It gives things to be attached to, but there's absolutely no power of movement from the chassis of the car or the skeleton. And so the joints of the dog, they're represented by the tyres, the wheels of your car. And again, these are loose links, so I'm talking about the synovial joints, which are all about movement. And these are like the tyres or the wheels of your car. They don't go around independently. They're all linked up in a complex system, and they definitely don't produce any power of movement. They're all interlinked and driven by something else. And the stabilising structures around the joint give it stability. But if they fail, like a cruciate ligament, then we've got a major impact on the efficiency of movement. But there's no power from a joint. And so where does the power of movement come from? Well, we've got two things to think about. It's going to be the muscles of the dog, so some are about stabilising and some are about powering, and they represent the engine. They're represented by the engine in the car. And they don't turn on and off spontaneously, they're told what to do. So the car's management system, like the black box, that represents the proprioceptive system, and it's not just any proprioceptive system, it's the canine proprioceptive system, which is very different to the wiring that you see in a human patient. So we've got a quadruped with digigrade stance, so they stand on their toes naturally with paw balance. They have an amazing distribution of their weight, and they are designed to move efficiently in natural balance canine motion. And we're really thinking about that group 3, the rhythmic motor patterns, which is all about how they walk, trot, gallop, swim and move. It's full of their daily lives. So now we're going to really examine the proprioceptive system, take it one step further. And the first thing we want to just touch on before we go into that are CPGs. So CPGs are known as central patterning generators or central processing generators, and they are biological neural networks. They're like a mini computer linked up and part of the central nervous system. And they're incredibly important because they produce group 3 movements. We've looked at the types of movement that we want to impact with our treatment techniques, and using canine movement enrichment techniques maps in directly to group 3. It also integrates to the canine biomechanical model. The dog is designed to move forward in the sagittal plane. That's its function. And we also have these extensor patterns, anti-gravity muscles keeping the dog up against gravity. So integrating that with the canine proprioceptive system is going to give us the complete story of how dog movement is organised, because it's really different to human movement. So if you think of receptors, they're like satellites. They're all over us and they're all over the dog, but you find them in muscles, ligaments, tendons, joints. We've got special proprioceptors in the dog's eyes. We've got a group of proprioceptors in their pads and their paws as well. And also the sensory receptors in the dog's skin contribute to the proprioceptive information. They're like secondary proprioceptors because they have another function as well. All that information is like incoming into your laptop. So think of the laptop as the central nervous system. Now in humans we have a main laptop which is found in our cortex, and our movements are very cortically organised, whereas in the dog, their main laptop is in their brainstem, and it's connected to a whole series of mini computers. So in a human, we've got a few mini computers, but our movement is predominantly group 4, and it's cortically organised and learned patterns. Whereas in the dog, it's spinally organised through the CPGs because they give this output, this rhythmic output for group 3 movement, to walk, to trot, to gallop, to breathe, to chase, to run. All their activities we're trying to improve so they're happy, healthy dogs. In the dog, they have a huge number of mini computers that are linked to the main computer in their thoracic and lumbar spine. So the information coming from the receptors comes up the afferent fibres. These are the incoming into the computer, and there's hundreds of thousands of routes in. The computer mainly, it integrates that information, but mainly stores it all in the dog. Only a small amount is actioned because their wiring is really different to humans. And that information from the laptops goes down the efferent or efferent pathways to the end organ or the muscle that it's going to action. Now this is where it gets really exciting in the dog. The neural networking in the efferent or efferent pathways are really different to humans. So in humans, we have 2 or 3 million movement sequences that we organise, and they are going to be eating, drinking, buttoning up buttons, doing surgery, writing, playing an instrument, and these are learned patterns that we have learned over time. We have a little bit of background information, which is our rhythmic motor patterns, and that's how humans are wired. Dogs are totally the opposite. So we predominantly use our pyramidal pathways. We don't have many CPGs because it doesn't fit in with our neuroanatomy and our design. Whereas a dog has a huge number of CPGs and has a huge amount of information that's organised at spinal level. Their afferent or efferent pathways predominantly use the extrapyramidal pathway, and that's about rhythmic motor patterns. Whereas their pyramidal pathway, which is their B road, their smaller amount of movement that they call upon, are learned movement patterns. Now this should really excite you as a therapist, so you are going to use canine movement enrichment techniques, working with the dog in natural balance stance, natural balance postures, and natural balance motion. Innately within them, they are designed to have this motion. And that's what we want to enhance or improve when they've had some kind of movement dysfunction. Whereas learned training techniques or tactics, teaching the dog to sit up and beg, teaching the dog to take a treat and sit, they're learned patterns of association. They're not as useful for the dog if you want to have and optimise the outcome of your treatment techniques. So using canine movement enrichment techniques, which incorporates clinic enrichment, and therapeutic handling techniques as a whole range that are safe, map into the canine proprioceptive system, map into the biomechanical design of the dog, and also are all about that group 3 type of movement. It's about integrating and working with the dog. Now we've had a little bit of noise, and just down there we've got a beautiful little puppy who's a new member of Canine HS, and the next thing we're going to look at is going to be muscles, muscle power and muscle patterns, movement patterns. Thank you, Tom, for joining in. This is lovely Lily. She's an 11-year-old female border terrier, and she's going to help me with the next few points. So the next thing I want to discuss is really looking at this power of movement. So Professor Alexander, a lifetime of work, the evidence that the power of movement in the dog is the product of the proprioceptive system and muscle power. So muscles, they have very specific actions, and really to get an in-depth understanding of when in that sequence of movement the muscle contracts and works and generates the power is ever so important. And the other thing to consider is that the majority of canine movement is eccentric contraction, eccentric loading, which is very different to humans. So in the agility dog, we've got research to show 99% of movement is eccentric loading. So always incorporate some eccentric contractions in your treatment program. And you can do that by incorporating your canine movement enrichment techniques that work with the biomechanical model. They work for the type of movement we're targeting, and they're hugely proprioceptively enriched. Lily is just checking out what's going on, and the next thing to think about is the muscle power. Let's have a look at the movement sequence. So muscles don't work alone, they don't work in pairs. A sequence of event is orchestrated by the proprioceptive system. Just like when you're eating, dressing, driving, that sequence is complex and organised by your proprioceptive system. We know that we've got sequences in the dog, and we also know the biomechanical model is about the legs are key to supporting the dog against gravity. So the sequence you want to focus on as a therapist or a professional to improve the dog's movement will be your extensor sequence, not your flexor sequence. The extensor sequence with your anti-gravity muscles is all about supporting that dog. If the dog has got an underlying problem and they're offloading it, they're going to use their flexor pattern. So we want to focus on the extensor patterns of movement and those anti-gravity muscles. When we're going to look at movement, we've also got to consider the breed biology, because we know, and it's a fact, that the movement of a Chihuahua, which is normal for a Chihuahua, is going to be abnormal for a Basset Hound. And a Basset Hound's movement is going to be normal for that breed, but it would be abnormal for a Greyhound. So understanding your normals is essential for each breed before you can then analyse and improve abnormal movement patterns. So breed biology, understanding that we've got bigger conformational and morphological changes in this mammal than any other mammal on the planet, it's incredible. We need to have that information on the breeds that we see. Another really valuable area to explore is canine behaviour. And it isn't any canine behaviour, it's canine behaviour in context of your clinic. So you can see that if you've got a dog that's working with you, focused, confident, and trust the hands and the guidance you're going to give, you're going to get really amazing outcomes. So in the context of the clinic, we're looking at the feedback signals of each dog and understanding that language, and we want to respond with their language, not with our language. So just remember, dogs are watchers. They watch and observe. Their main way that they communicate with each other is through body and facial posturing. Whereas we're listeners, we have conversations and language. So that mismatch causes a lot of issues. So when Lily turns to me, I turn my head away, and that's answering her looking at me. And by working with the dog, then we're going to get them to consciously mediate and work with us. And why is that important? Because we know that active movements that are consciously mediated are hugely proprioceptively enriching and very beneficial to improving movement patterning in the dog. So canine behaviour in context of your clinic is such an important topic to explore and find out all about. Following on from canine behaviours in your clinic, we want to use clinic enrichment, and that is part of canine movement enrichment. It isn't about making yellow brick paths around or corridors around. It's much more than that. It's what you do with your body posturing and language to the dog. So Lily's just thrown out a calming signal there, but then she's settled down. It's about working with the dog and setting them up to achieve, and we can do that by enriching the clinic environment in lots of different ways that are very meaningful to the dog. Now, another tool that we can use is we can use a Y-shaped harness. Now, you may ask why a Y-shaped harness? It's because it optimises natural balance motion. We can see the harness comes here and goes down between the legs and does not come or impede any movement here. There's the shoulder joints from protraction or retraction. We don't want to have a harness that in any way prevents that natural balance protraction and retraction flow, because otherwise the dog's got to compensate somewhere else. And where it will compensate, it will have shorter protraction and retraction phases, and the lumbosacral junction will over-engage. So working with your dog in natural balance motion, natural balance stance, natural balance postures, helping the dog to understand where that is and reinforcing it with some sensory work that integrates with the Y-shaped harness. It's not the harness that treats the dog, it's the therapist and how they use the harness. Moving on from the Y-shaped harness and therapeutic handling, so we're using therapeutic touch where every touch really counts. We know where the muscle dermatomes are, so we can put information into those. We know which muscle groups do have sensory information that goes to them and which just have a motor supply. So on top of that, we've got something called key points of control. Key points of control are awesome. I've been using them since the 1970s in my human neuro rehab work. And dogs have them too, not as many and in different places obviously. So a really useful key point of control for you to know about is the sternum, the manubrium, the first sternobrae. And with a Y-shaped harness, what we can do is we can use a therapeutic hold, so it's not about emergency stops and banging on the brake, it's about slow rhythmical motion, and there's a whole range of different therapeutic holds. And what I've got here is I've got her contact here at 2 points of control, and I'm using a key point of control on the sternum. And what this does is it helps the dog work in natural balance postures, natural balance stance or lying, natural balance motion. And then when I want to take the brake off the sternum, I can bring my hand out and use it as a visual indicator as part of my movement shaping techniques. So therapeutic holds map into key points of control, but the key point of control is also a motion point, so it's got a double purpose. They are absolutely awesome and they control the event of movement sequences in the limb or in the dog. Integrating all the scientific facts and the concepts we've been discussing is all about devising an individual program, treatment plan for the dog in your professional care. We know it's a fact that dogs' emotions impact massively on the muscle tone that they're feeling, and that they have responses in the clinical setting due to pain, maybe due to the unknown as well. So by working with the dog, and not on the dog, delivering a treatment plan that you've organised and plucked out of your treatment toolbox, your therapeutic treatment toolbox. And key to that should be incorporating proprioceptively enriched movement enrichment techniques. They're standalone treatment techniques, and they're also the glue that helps put everything together when you're delivering other therapies. So I hope that's been useful, and it's all about the dog.
Dogs communicate mainly by using body posturing and facial expressions. They come in all shapes and sizes. Border Collies have low-angled hocks, which is great for turning quickly. Different breeds have various types of coat and ear shapes. Each dog has its own personality, as well as a breed temperament. The bond between therapist and dog is a connection of trust. Working with dogs is the best job in the world.